Hello, this is Sue, and today I'm with Dr. Hawass, and we're going to discuss some of his expert opinion on arthritis. So, Dr. Hawass, tell us, how do you treat arthritis?
Yeah, so arthritis is a very complex disease. Most people think of it at a joint level, which is a deterioration of the cartilage. The way I look at it, it's not just the cartilage, it's all the supporting tissue around it. So when you have the ligaments, the tendons, the muscle that support the joint, and even tracks up to the joint above and joint below. Unless you restore the integrity of the whole unit, you're not going to be able to treat arthritis. And unfortunately, the current system or modalities to treat arthritis is basically targeting only the cartilage or the joint itself, and it's not dealing with the integrity of the full length of the joint. So as an example, if someone comes in with a knee pain, or first of all we identify if they have arthritis or not, then we're going to check the integrity of the ligaments and the tendons around it, and go even above to the hip joint, and so most likely they're going to be affected with the hip joint as well, and usually the what we call it the gluteal tendons, which is the tendons that support that joint. So if I'm going to treat all that structure at once.
How do you check it?
So I do check that when they come into the clinic. We do a physical exam, we review the history, and I do an ultrasound on them, and that's how I check if they qualify or not qualify for the procedure. One of the modalities that we use, and the most thing that we use here, is a PRP treatment, which is a platelet-rich plasma.
What is PRP?
Yeah, so I want you, before go through the details of that name, I want you to think of if you have arthritis in any joints of your body, this for the last couple of years, if you cut yourself, you watch the wound heal, and the wound would heal within 7 to 10 days. So what caused that healing? What caused that healing is the platelets, the plasma that kind of brought that wound together and made a scar and eventually healed it. So your body is capable of healing, and so what we do, scientists have found out how to isolate those healing properties from someone's own blood. So we process that on site. It takes about 20 minutes or so. So we take a blood sample, process it through the centrifuge, and isolate those healing properties and kind of re-inject them in the areas that's affected, which is the cartilage, the joint, the ligament, and the tendon.
And that's on the same day?
Yes, it's the same day. This is not a surgery, so most patients are, like, the patient will be awake, and we're just going to do a little bit of a local anesthetic to the area, and a patient will go home. The whole procedure takes less than an hour, and patient will go home that day. Recovery usually lasts between a day up to 3 days, and by the third day they can go back to work. So it's not that restrictive like surgery. Hi, this is Mark from ArthritisVIP, Toronto's #1 provider for arthritis treatment. If you're tired of being in pain and looking for a non-surgical solution that has proven track record, then contact us at 647-540-4025 or visit us on the web, arthritisvip.com.